I'm going to be presenting on stress and resilience during COVID-19 pandemic, and I'm going to get started. So I don't have any disclosures. I don't have any financial support to disclose. And this is a slide that just indicates how we mitigate potential bias. The information I'm going to be presenting today is largely evidence-based. Some aspects are evidence-informed. And I'm just going to quickly run through the learning objectives, which are to describe burnout and compassion fatigue as part of a continuum of occupational stress during COVID-19. We'll consider the neurobiological stress response patterns and opportunities to build resiliency during this time, and also discuss some different approaches to building resiliency to manage this stress during the COVID-19 pandemic. So I'm going to start off by defining burnout. Burnout is a workplace phenomenon. It has three core domains. The most robust and typical, particularly in the health professionals, is emotional exhaustion. This idea that we get to the end of our day and we're just completely spent, we have nothing more to give. A second domain is depersonalization, this sense of sort of profound disconnection from the individuals that we serve. This idea that potentially people or patients or clients become objects. And this idea of decreased personal accomplishment, what I do doesn't matter. It's helpful to note this literature is very expansive and is developing literally day to day. There's another kind of report or article on this. Within the health professions, the least likely domain that typically is implicated is decreased personal accomplishment. And there's been a couple of really interesting studies, one by Shanafelt in the States and also by Jane Lemaire here in Canada, that have indicated that typically if a health professional has approximately 20% of their practice or career that is meaningful, that's enough to sustain them. So we're not required to find every day and each and everything that we do meaningful, but about 20%, which in the grand scheme is not a lot. And that typically health professionals struggle the most with this idea of emotional exhaustion. Burnout is a state of physical, emotional, and mental exhaustion that's caused by long-term involvement in emotionally demanding situations and often results from the harmful effects of overwhelming demands of the workplace on the worker. It's an occupational phenomenon, and I think this is important because sometimes there's questions about whether this is a diagnosis and to what extent it maps onto other kinds of diagnostic entities like depression. And this is very specific and related to workplace distress, and it's specific to one's professional life. It is not a medical condition and doesn't relate to areas outside of life or outside of someone's work life. And I think that's important because often when factors can be changed or influenced within someone's work or job, or somebody leaves a job or a role, often the burnout will resolve over time. So this is a graphic that gives us an idea of some of the consequences of burnout, both personal and professional. And there's many, and again, there's a large and expansive literature around this. I think it's important to note that the majority of this research has been through systemic analyses and also cross-sectional studies. And so more kind of longitudinal and prospective studies are needed to kind of strengthen the correlations between these things and the relationships. But some of the personal kinds of consequences have to do with interpersonal stress and potentially broken relationships, increased use of alcohol or substances, likely related to kind of an avoidant kind of coping strategy, a relationship with depression and mood disorders, and also a relationship with suicidal ideation and behavior. In the professional realm and more kind of systemic and organizational, there's evidence that there's decreased quality of care and increased medical errors, decreased patient satisfaction, potentially decreased productivity and professional effort, and increased staff turnover. Compassion fatigue is another kind of fast friend to burnout. There's more literature around this in some of the health professions literature and nursing literature than in other areas, but it definitely is something that is being written a lot about. It has to do with when practitioners have a reduced capacity to be empathic or bear suffering of others, and leads to a sort of profound emotional and physical erosion that takes place when helpers have less ability to refuel or regenerate. And it can lead to a disconnection of hope and one's ability to tolerate strong emotions and difficult stories. And we hear about this a lot in areas where people are doing a lot of kind of patient contact or client contact, mental health professionals, nursing, social work, also medicine for sure. And to what extent some of the terminology around compassion, fatigue, and burnout, there may be similarities. I think more research is needed in that. I think the good news is that these are things that are being studied and there's increasing attention on them. It's important to be aware that social connectedness and compassion fatigue are linked, and that, and I'm going to be talking about this a lot today, but when there is increased social support and connectedness with colleagues, it tends to reduce the risk of compassion fatigue and reduces the level of cynicism and negativity in the workplace. It can also reduce toxicity and negativity in the work climate. And the extent to which somebody may be struggling with compassion fatigue can certainly impact the extent to which they may turn to colleagues for support and also in turn offer support to others. This is a slide and a graphic that I'm going to use to try and locate burnout and compassion fatigue in contrast to sort of a continuum of different stress injuries that health professionals can struggle with, and some of which have already been highlighted and that we're aware of during this time of COVID-19. So burnout and compassion fatigue would live sort of over on the right in these fatigue injuries, sort of that wear and tear over time due to an accumulation of stress from many sources. But it's important to recognize that, you know, within our kind of health professional community, there are a lot of other things that can impact individuals. So traumatic injury related to an exposure of an intense injury, grief, which we've talked about here within this community, related to the loss that people have experienced both professionally in their work roles and also personally. And also this idea of moral injury or moral distress when one witnesses behaviors or due to behaviors that may violate or are not aligned with our values. And so I think it's important to remember that, you know, it's not like we only might experience one of these, and also to realize based on the literature that approximately 40 to 50% of the healthcare population may already have burnout prior to the COVID pandemic. So to be aware that there's a lot of different moving parts to this. I also think it's important to think a little bit about some of the cultural aspects of this and the values that can kind of underpin some of the vulnerabilities that we may have. The kinds of values that lead one into the health professions that can make somebody more vulnerable to compassion fatigue or burnout over time, particularly during a public health emergency. So if we think about the guiding ideal and value of selflessness, that, you know, we might place one's welfare over our own, and that this could become a vulnerability to the extent to which we're able to prioritize our own needs and health issues if they were to develop. The value of loyalty and the strong commitment to service that health professionals have to protect and reduce suffering, and some of the guilt and complicated bereavement that that might go along with that in situations where we may be less able to provide that service because of different changes related to the work that we do during the pandemic. This idea and value of stoicism, kind of toughness and grit, the ability to kind of endure hardship without complaint, can make one vulnerable to being less aware, being able to acknowledge or being insightful around symptoms that one may have or suffering that they may be experiencing themselves. And I think also to highlight, certainly in the roles that I have, I see this regularly with health professionals, this kind of commitment to excellence and professionalism and wanting to kind of maintain a very low margin for any error. And during these times where we're adapting to very different kinds of practices and processes, where portions of our community and population are being redeployed to areas where they may have less competency and skill and experience, it can be very challenging to try and discuss some of those difficulties that we may be having, and there may be a tendency to deny difficulties or feeling ashamed about that. This is a slide that I think is really interesting beyond kind of the culture and values, to think a bit about how those values may also inform the way that health professionals might cope. And this was a really elegant study that was done by Jane Lemaire here in Canada with approximately 1,200 physicians. And they looked at their burnout scores and also looked at and asked these physicians how they tended to cope with stress related to workplace issues and related to their practices. And these were the three most common coping strategies across the participants that were involved. First was to keep stress to themselves, to concentrate on what to do next and kind of avoid what was going on, and this idea of going on as if nothing had happened. So a fairly kind of avoidant coping strategy, and they were able to correlate that these coping strategies actually perpetuated further feelings of emotional exhaustion. So I think it's helpful to be aware and mindful that some of the ways we may be less consciously kind of coping with stress in the workplace may actually exacerbate some of these issues. So this is a helpful way to kind of perceive burnout on a spectrum, with burnout at one end and engagement, which is characterized by vigor and dedication and absorption in work, on another, and that there are different kind of driver dimensions that inform where we might be on this spectrum, and that we might be in different places on this spectrum depending on which driver it is. And I've added some nifty, sort of not very high-tech animation, but to this slide to really kind of emphasize where in the literature, or where kind of in an evidence-informed way, we are aware during the pandemic that some of these drivers have shifted. So in terms of the efficiency and resources that are available to us during this time, the workload that people are enduring and taking on, and some of the job demands that have changed, certainly earlier in the pandemic and as it fluctuates with different outbreaks. If we think about the different kinds of ways that we work now virtually, and some of the cognitive load in terms of learning new skills and processes, if we think about Zoom fatigue and how we've tried to learn to adapt, and some of the impacts of some of the virtual care, and also some of the loss of control and flexibility that we may have because of changes in work processes or demands, increased need for coverage or call. Work-life integration, which is something that has become very front of mind as people are working in different virtual settings, or adjusting and changing their schedules to be able to meet the increased demands. And then again, this core idea of social support and community at work, and the extent to which that may have been available before, and then how that may be more challenging now with so many of us working virtually, or even in our workplace settings in hospitals and clinics where there's a requirement to physically distance, and we're doing more even virtually within our workspaces when we're in the hospitals. So I'm going to shift to talking a little bit about different approaches to stress. And I think it's helpful to start by sort of locating this idea of workplace resilience and thinking a little bit about it as an ecological model, with the individual sort of embedded and interdependent with some of these different systems and organizations that we work in. So thinking about teams and managers, organization and culture, and also the sort of neurobiology of stress, which I'll get into, and how all of these things are linked. And I think this is a helpful model because it's consistent with how we think about health professional training and education, and it places emphasis on the systems and organizations in which individuals work and interact with clients and families, and not on the individual themselves. And there's certainly lots of different models. In the world of well-being and burnout and compassion fatigue, those models that have placed increased emphasis on individual resilience over that of systems and organizations have been less helpful over time. So this is a slide that I borrowed from Chantal from a really elegant presentation that she did earlier on in this Coping with COVID. And it really emphasizes this idea that the patterns of stress and how we experience stress can impact the extent to which we're able to develop resilience to it. And that when a pattern of stress is unpredictable and extreme and prolonged, there's a greater likelihood of us becoming sensitized and vulnerable to that stress. And when that pattern of stress is more predictable and moderate and controllable, there's an opportunity for tolerance and the development of some resilience. And I think it's also helpful at this point to just give some definition to resilience. It's a huge topic, but to think a little bit about resilience being an ability to demonstrate, in the face of a significant stress, the capacity to respond and return to a state of stability over time afterward. And it's not a power we can summon. It's not something that we can develop by going to a one-time workshop, that it's really something that develops over time, and that stress in and of itself is not a negative thing, and that we require it for healthy development and to develop resilience. And there's no greater time or opportunity to be able to do that. And I'm going to talk a little bit about ways that we can try to look at the extent to which we expose ourselves or manage this stress. And this is a model that looks at how, when we're able to increase and provide structure to how we engage with stress, that we're able to kind of mitigate it to some extent and develop resilience. And if you look at the model on the right, things like daily structure, intentionally limiting media, exercise, sleep hygiene, good nutrition, maintaining a positive outlook, those things really can tend to shift patterns of stress into becoming more predictable and moderate and controllable in how we engage with them. And I think it's important to also note that there's a fair bit of privilege and opportunity in terms of individuals that are able to kind of provide this structure, and those that may be less able to because of time, because of resources, and that those that are more marginalized may have more difficulty or less kind of control and autonomy within their schedules to be able to navigate and bring that kind of structure. And I think that's a really important thing to be aware of as we think about this, and the moral imperative for those of us who are able to kind of manage this stress in a different way to support those that may be less able during this time. This is the Stanford Wellbeing model. This was developed by Tate Shanafelt and colleagues, who I know is a bit of a rock star in this community. And I think it's helpful, again, to kind of think a little bit about the different kind of key domains in an organizational model of resilience and well-being, and this idea of developing a culture of wellness, any kind of commitment that's needed from leadership and organizations to be able to do that. This idea of efficiency of practice and thinking about redundant workloads and ways to optimize workflow. There's a large body of literature that is linked to the electronic health record, to things like burnout, and to what extent that could be mitigated. And certainly during the pandemic, we've seen different opportunities where workflow has shifted. Some of the priorities in terms of different leadership things have shifted because of the need to focus and turn our minds to the pandemic, and also thinking a little bit about redundancies, the different kinds of training that we normally do and what can be kind of delayed, different communications we may have with some of our different professional colleges around requirements now versus later, given the kind of acuities and priorities that we need to focus on during this time, and realizing that we can't keep doing it all and absorbing more. And then again, this idea of personal resilience, but really kind of having that be less of a, like only a third of this, and understanding that there's a key kind of relationship between time and resources and the ability that individuals within a workplace are able to engage in self-care and peer support. And when there's less time and resources that are specifically designated and protected by leadership in the organization, there's typically less self-care and less peer support. So to be aware of that relationship. And I've left the link for this model and a lot more information about it if people are interested at the bottom of the slide. I think it's important to be aware within our workplaces and our communities that certainly individuals are at risk of developing prolonged stress reactions, and to be mindful of this, that you know, there are certain signs of this. So someone that has a significant or persistent negative change in their behavior or habits, maybe engaging in a characteristic that's or a behavior that's uncharacteristic for them, maybe making mistakes or more mistakes than they typically would, or becoming more isolated if we think about some of those avoidant coping strategies, or engaging in more compulsive behavior around checking, maybe kind of contact with media, those kinds of things. And I've attached a link of how to approach a colleague in distress, and there's also another link to the AMA Steps Forward program, which really, there's a ton of literature around professional well-being. So if we think about some of the literature that existed before COVID, certainly some of the key things that were identified in terms of supporting resilience and well-being and mitigating burnout and workplace distress, a lot of that has to do with social support and connectedness and community building, which we've talked a lot about, and also different leadership strategies to support that, and a sense of sort of calm leadership, and this idea of an emotional contagion, and the extent to which when leadership is calm, they're able to kind of create a sense and a culture of calmness within the workplace. And also this idea of grief leadership and being really aware of the experience of healthcare professionals at this time, the potential losses, and having a trauma-informed perspective to that. So this is another slide. Again, I borrowed this one from Chantel, and I think it's a nice kind of amalgamation of the Shanafelt article that really looked at kind of the 5 key priorities for leadership and organizations to try and support well-being of healthcare professionals, and also an example at Princess Margaret where they have tried to enact this and do this practically. So this idea of healthcare workers needing to be heard and protected and prepared, that's been factored into decision-making and communications at that site. And also this idea of wanting to support and care for healthcare providers by providing lots of different opportunities for social connectedness, for support, for psychological first aid, buddy programs, different toolkits that are available, and different ways to engage online through virtual coffee meetings or meditation. I think it's important that none of this be prescriptive and that there be a menu that people can kind of pick and choose from. And then finally, I'm just going to talk about this as an example because I think it's a really pointy example of organizational culture and this idea of organizational resilience. And this is an example of some research that came from an individual named Mark Maltz. He was a consultant in an organizational development who worked with financial institutions after the events of September 11th. And he did some research and found over time that there were key characteristics of different institutions that were more and able to rebuild themselves and be resilient in that context. And interestingly, one of the kind of significant themes that emerged was this idea of valuing and investing in human capital. So the workforce that was there, the relationships and teams that were there, and that those institutions that had really strong kind of trusting, a lot of psychological safety within their staff teams tended to be more resilient, where there were strong kinds of aspects of mutual trust and respect, and that there was this ability to grow this capacity. And much like kind of building organizational reserves or thinking about inoculating people with the flu vaccine, that we could actually inoculate staff from stress by actually kind of working on creating greater connectedness and greater kind of effectiveness within teams. And that these teams that were more affected tended to have strong sense of organizational purpose or a moral compass, and were able to kind of agree on the kind of primary work that they were engaging in, and that there was a clear and very positive presence of leadership and this sense of organizational trust, and leaders were experienced as being competent, benevolent, and operating with integrity. And I think that's something that's really helpful to think about when we think about how our different institutions and teams are working in this time, and where there's kind of opportunities to really think about some of these things in an effort to kind of inoculate ourselves from stress or try to work at mitigating stress at this time. So these are some resources. These will be available on my slides that are available to the group. And I'm going to stop there and hand it back to Chantal.